Good morning. My name is Stephanie Rollins, and this morning we're going to talk about program evaluation and outcome measures. But first, let's define a program evaluation. A program evaluation consists of systematically collecting evidence that, once collected, provides the means to assess and appraise the quality of a counseling program, which in turn assists the decision-making process that will influence change in the counseling program, thus affecting service delivery. Now, the purpose of a program evaluation is to determine its effectiveness. Is it adequate? Is it useful? Is it feasible economically, resource-wise? And is it culturally ethical? Now, speaking of evaluating a program, we determine how to evaluate that program not just by the evidence, but from the outcome measures. And outcome measures, in this case, can be qualitative, quantitative, or behavioral data. And based on that evidence collected, a judgment can be made as to the value or merits of the counseling program, interventions, and outcomes. Now, outcomes, what they measure, not just the goals and objectives that we determined through a needs assessment, but they're also designed to inform us if we have achieved the change that we set out to achieve. The client. The client is also a variable that will help us determine these outcome measures. Did we achieve the change that we set out to achieve? The goals and objectives that we planned, that collaborated with the client on. And again, measuring those outcomes quantitatively, numerically, qualitatively. To do that, there are different parts of an outcome measure that we want to ask. What is going to change as a result of the program? How much change will occur or did occur? Who will achieve the change? The target population, the client, and when will that change occur? How many sessions? How long? And measured by what? Is it measured quantitatively, qualitatively? Is it the outcomes and goals and objectives that we collaborated with the client? Is it going to be measured biologically, psychosocially, behaviorally, economically? Those outcome measures are necessary to tell us if we have achieved what we set out to. Now, some culturally relevant issues to consider when conducting research, and referencing the Andrea Heckman article and our text. When conducting research, it's best to overrepresent diversity in our sample. Now, as counselors, we are tasked with the responsibility for implementing empirically tested services, yet a disparity exists in the number of multicultural counseling outcome studies published. So my takeaway from that is to overrepresent diversity in our samples, in our programs, and with experimentation, because there's not enough data out there, not enough multicultural counseling outcome studies available. Now, how does this, well, first, let's address the elephant in the room. That's been there all along, that we've just overlooked, and that's spirituality. Spirituality. And how does this all apply to faith? Well, it is always right to examine our processes and outcomes of these processes, but it is necessary to also examine if our processes are faith-filled and in keeping with our clients' beliefs. We would be remiss if we did not acknowledge spirituality as an intervention, as part of the counseling process.